Welcome to Evergreen Family Medicine. Today we are with Shaina Yecha. She is a DO at Evergreen Family Medicine. Welcome in.
Thank you.
Nice to meet you.
You too.
So tell us a little bit about what you do at Evergreen Family Medicine.
So I'm a family practice provider. I work outpatient right now. Basically, I do a lot of women's health. I enjoy taking care of people with diabetes, people with rheumatoid type conditions, rheumatology. So a little bit of everything.
So what's a typical day like for you?
I don't know that there is a typical day. It always varies, and that's part of what I love about family medicine. So, a whole range of things. You can see somebody with a heart condition, and then you can, be taking care of an orthopedic condition, a lot of variety, so.
And if you also have the women's health element, there's a crossover there as well, right?
Absolutely. Yeah. And children. I love seeing children. I should have mentioned that earlier.
Well, tell us how you came to be here in Roseburg and working at Evergreen.
So my husband went to high school at Douglas High School. So we were aware of the area because of that. I originally grew up in Yakima, Washington, and so we wanted to come back. We trained out in Oklahoma. We wanted to come back to the Northwest, and Roseburg was just a perfect fit. So we got in touch with Dr. Tim, and then everything went from there. So.
And how has your experience at Evergreen been?
It's been very good, very good. Yeah, we really enjoy it.
Our producer is telling me in my ear to make sure to ask you about following in your dad's footsteps. I don't have much more than that to go on. So what is that referring to?
So my dad is a family medicine and OB doctor up in Yakima, Washington. And so growing up, I would say that definitely his love for medicine fostered a love for medicine in me. Just getting to see how much he enjoyed taking care of patients and the community. He's been practicing there ever since he graduated residency. So he's stayed in the same area for his entire practice. And I really admired that and loved getting to see the way that he was able to help people and continues to help people. So definitely it put a desire to do that in me as well. So
earlier when we were talking, diabetes came up. You mentioned diabetes as a specific thing that you are interested in or have expertise in?
Yes, both.
Talk to me. Okay. All right. What's happening there?
So I really enjoy taking care of diabetes. I enjoy the challenge of it, the complexity of it. It's a difficult diagnosis for patients to take care of, and I like to partner with them in that and to basically offer them support. One of the exciting things that we're doing here at Evergreen is basically putting together more resources and a team of people to help patients better manage their diabetes. And so that's something I'm really excited for in the upcoming year to just help patients with.
A couple things come to mind when you say diabetes and more resources. One is T1D, type 1 diabetes, which apparently is just spiking. I don't know if it's just here, but it definitely is here and maybe everywhere, I would think. Right. But that's one thing. And the other is that it's both genetic and potentially from a diet perspective that can lead to diabetic condition.
Yes, different.
I don't know which one of those two to talk about first, but how about just a little bit about T1D and how prevalent it is here?
Yes, so absolutely. Type 1 diabetes is so it's an autoimmune condition. And typically, in the media and stuff, it's referred to oftentimes as childhood diabetes or juvenile diabetes. People generally develop it when they're younger, although you can develop it later in life as well. And so that disease process, basically we're looking at treating that with insulin. It's another synonym for it is insulin-dependent diabetes. Certainly, though, we can see some overlap. So for people who have type 1 diabetes, they can become increasingly insulin resistant, just like you would, like someone with type 2 would become insulin resistant if they have some of those either hereditary factors or weight gain, things of that nature. So there is a little bit of crossover in that area. Type 2 is more that's the majority of the diabetes that we see. That's the, as media portrays it, the adult onset type of diabetes. That one can be controlled with both oral medications and then also with insulin and exercise, diet, all of those things. And so both forms of diabetes are complex physiologically. They're challenging, but they also, when they're well controlled, people can go on to really live completely normal lives. And so that's what's exciting about taking care of it, is seeing people be successful with it. So,
which I'm told is a very important message for young people who are diagnosed with type 1 diabetes, right? As far as like that support system and talking to a doctor before you decide whatever this means for your life, right? I mean, because like you said, there is medicine, there's hope, there's work, there's support to live with diabetes, whether type 1 or type 2.
Absolutely.
Yeah.
Absolutely.
Thank you for your time today.
Absolutely.
All right. Shaina Yecha, one of the providers at Evergreen Family Medicine. You can learn more about all the providers and a lot more about what's happening at Evergreen at evergreenfamilymedicine.com. And you can follow us on Facebook, Twitter, Instagram, and YouTube.